In, in order to receive transportation assistance, clients must have a valid driver's license. In order to receive car repairs assistance, license, insurance, and registration must all be current. Clients must be working 20 hours or more a week, attending weekly medical appointments, or be on a fixed income. And our car donation program, clients must be working 20 hours or more a week or attending weekly medical appointments. The typical wait time once you are placed on the wait list is approximately a year to a year and a half. The reason we do emphasize once placed on the wait list is sometimes our car donation wait list is not open, and clients might have to call a few times to potentially get on that wait list. Clients must be able to purchase insurance and registration for the vehicle. Eligibility is based on a questionnaire that determines the highest need, and that's also reviewed by a committee. And vehicles are available as they are received. So unfortunately, we do not have a car lot. We do not have vehicles readily available. It is solely based on the generation of the community and getting vehicles that are sound enough to pass along to clients. Helpline services that we provide, utilities, both DT and water, and you must have a denied SCR. We can help with personal documentation that includes birth certificates or IDs, and we do ask that an agency refers. We do prescription medications. A letter of medical necessity is required from a physician. Eyeglasses, other prescription medical needs, including shoes or adaptive equipment. We can sometimes pay for internet bills. Clients must be using the internet for work or have children who are participating in remote schooling. We will ask for the full bill breakdown for internet services if that is something that your clients do require. And any unusual circumstances caused by COVID, please give us a call. We also help pay for dental procedures. We can't really pay for debts, but if there is a procedure that is upcoming, but an individual is expected to pay upfront, we might be able to help with things like that. Storage units, if you have a transition plan, we are happy to help with things with storage. Employment cost, fingerprinting, work shoes, work or school uniforms, anything that's preventing you from getting a job or doing your job, we're happy to help. Housing, we are limited to half a month's rent. You cannot be eligible for HAWC services and an agency referral is required. We do have a standing relationship with Housing Access, and they do at times make referrals. However, if you are an agency representative and you have clients that might not even be eligible to get an appointment with Housing Access, but still need that type of assistance, please reach out to us. And of course, if you can't find the help anywhere else, please give us a call. We love WEIRD and we will do what we can to help. So the transportation and helpline hours of operation are Monday through Friday, 9:30 to 2. Please do not let these limited hours discourage you. We ask that people call even outside of these hours, leave a message. We will call you back as soon as we can. And the general process for the helpline is to call, send in paperwork, complete an intake, and speak with the case manager. And as well as with furniture, we can only provide this type of financial assistance once every 12 months. I will clarify that if you are getting furniture assistance, you are still eligible to get the transportation or helpline assistance. They are separate programs. We do have a national program called Circles. And what Circles is it's a national program designed to inspire and equip communities to reduce poverty and remove the barriers that stand in the way. Circles is a nearly 2-year commitment for individuals and families that are trying to break the poverty cycle and gain financial independence. Circles is relationship-based and it matches people in poverty that we refer to as leaders with 2 to 3 middle-income partners that we refer to as allies. How you become a part of the Circles program, Eligibility is be motivated, open to a new way of doing things, a desire to increase your income, and are not currently in crisis. What we mean by currently in crisis, for example, if you have somebody who is homeless and still needs to find secure housing, then we ask that they deal with that first and then give us a call. So with Circles, you will receive job and money skills training, educational support, support with parenting, health, and personal goals. There's a child or children's program with a kids curriculum because adults do not go through poverty alone. A large support system, a community of individuals to help you reach your goals. Circles typically meets on a weekly basis and dinner is served. And just a few national statistics from Circles. There's reports that after 6 months, people are able to increase their income at 39%, 54% after, sorry, I have a little bar blocking my view. After a year, 54% more income and 75% more income after 18 months. And those are national statistics. And here's how you contact us. The helpline has its own email address and phone number, same with furniture. If you have clients who are interested in the Circles program, you can reach out to them directly. And if you need to access myself or anyone else in the office, you can reach out to that admin line or email that office email address directly. I will leave this up so people can capture that contact information, and I am happy to answer any questions you might have.
So I do see a question in the chat. Does the car have to be registered to the recipient of assistance? Hugh asks because they have a client that uses their son's car.
So typically the individual that's registered to the vehicle would be the one that would have to reach out for the assistance.
Nancy asks if there's a maximum amount you fund per request.
So our funding can ebb and flow. So it's really best to call, reach out. We will treat those cases individually and see what we can do. Typically our maximum amount is around 500, but special circumstances might vary a little bit.
Emily asks if the utility assistance is through Barrier Busters. To my understanding, Friends Indeed often provides us matching funds. But did you have anything to add to that, Joy?
So you're absolutely right, Amber. We match funds typically with Barrier Busters, but our funding source is separate from Barrier Busters.
All right, I don't see any additional questions. Did anyone have any further questions for Joy or Kia?
Well, thank you again so much for letting us present here today. And if you ever have any questions, feel free to reach out and we are more than happy to try to work with you.
Thank you guys so much for coming today. We really appreciate you. I know that Friends Indeed is one of our favorite partners to work through on the weird stuff.
Well, we appreciate you, Amber. Thank you.
All right, Peggy and Nikki, are you guys ready to present? Any way I can assist you?
I am going to screen share if that's okay.
Absolutely.
Thank you so much for this opportunity to join you all today. I am Peggy Gillenberty. I'm the clinical director at Garrett Space, and we are a new service serving young adults with significant mental health challenges. Nikki, go ahead and introduce yourself while I find the...
Yes, hi everybody. My name is Nikki, and I am one of the facilitators at Garrett Space. And with that, I'm also a certified yoga teacher, and I'm getting my master's of public health. So with that, just that combination and adding to the facilitator role here at Garrett Space.
Okay, can you see the
Yes.
PowerPoint? Okay, awesome. All right, so Nikki and I are going to kind of tag team on this presentation. And I assume that many of you may not be aware of Garrett Space because it is a new program. Garrett Space was established by Julie and Scott Halpert after their son Garrett died by suicide 4 years ago. So we know that there are a fair number of services for teens and for older adults in our community, but very little for young adults, that kind of 18 to 28 age. So the goal of Garrett Space is to reduce suicides and fill that gap of service and support for those young people who have mental health challenges. Really, our goal is that hope and perspective and healing and connection to help build their resilience and their skills.
So the mission here, kind of as Peggy touched on, our mission here at Garrett Space is suicide prevention. And we're doing that in hopes to bring together a community for young adults 18 to 28 who are experiencing significant mental health challenges or mental health ailments. And with that, many of the people could be post-inpatient hospitalization or referrals from a therapist, any sort of just significant mental health challenge in their life. That's the mission there, to help prevent suicide. And as far as our vision, the vision is we want to create basically a residential center, groundbreaking, holistic, very holistically centered residential center for young adults where they can come and feel safe and supported. The idea is to have residentials, but then also for people to come in and out as they please. And here at the residential center, we hope to have, or we will have, individual and group therapy, along with peer support, support for families, and then also various activities throughout the week and throughout the day, activities focusing on improving mood and wellness, or creative expression such as art, yoga, cooking. So that is the vision for the future of Garrett Space, to create this residential center where people can come and enjoy just a safe space and community.
Okay, so the need for Garrett Space, we put a few stats on here for you. Suicide is the second leading cause of death among young adults. It was in 2019, the prevalence of suicide attempts was highest among young adults, 18 to 25. Last year, a CDC study showed that 25% of respondents 18 to 24 seriously considered suicide in 30 days before doing the survey. So we believe that the pandemic contributed to this high level of mental health need. However, these issues were there prior to that. I think, if anything, the pandemic elevated awareness of mental health issues. A lot more conversation, I think, kind of in the world about people who are struggling. But that statistic, 25%, I think, seriously considering suicide, is very powerful. There also was a recent survey done, partnership with Harris Poll and an Ann Arbor organization, that 70% of young adults 18 to 24 reported feeling moderately or severely depressed. So that's only a couple of months ago. Also a very powerful stat, I think.
So for the wellness groups, right now, the wellness groups at Garrett Space are really the bulk of Garrett Space. Since residential center, since we are new, we don't have residential center yet, but we focus on the wellness groups right now, which meet virtually via Zoom. We meet 2 days a week, and one day we focus on support and connection. The next day, or the second session during the week, is mood and movement. So within those groups, it's just 90 minutes via Zoom. Support groups are free to participants, anyone that wants to join. There's no cost, and they're ongoing, they're open groups. Right now we're meeting Tuesday and Thursday evenings. We plan to have more people and also more time availabilities when we have more participants that want to join Garrett Space. And right now, the wellness groups are led by facilitators. So I am one of the facilitators. And then also Peggy is in our wellness groups as our clinical social worker. So there will always be a facilitator and then a clinical professional or social worker in these wellness groups. And Peggy, also, could you touch on the YST program and that association?
Yes, so we also have a partnership with the U of M Psychological Clinic, and it is called YST. It's Young Adult Support Team. And this is a project that is led by Dr. Cheryl King, and she's done a lot of research with teens and suicide. So this is sort of an adjunct to that, is moving into the young adult population. So our participants are invited to enroll in this YST program, where they suggest or nominate people in their life to go through some training and how to better support them. So those might be parents or a roommate or a best friend or a partner. They go through some training and education, and really they are learning how to be there for their young adult long term. So we recognize that we won't be there forever, but hopefully their parents and close friends and partners will be there long term and will know how to best help them.
For eligibility in Garrett Space and also in our wellness groups, we're aimed for young adults. That's a demographic we're targeting, so therefore ages 18 to 28, and just really anybody who wants to or you think could benefit from additional emotional support, psychological support. Also for eligibility, the participant should be seeing their own regular therapy and psychiatric support on a regular basis. And we are just hoping that the wellness group kind of serves as a supplemental form of peer support for individuals who are experiencing a significant mental health crisis. And a lot of times people can be recommended after an inpatient or after a partial hospitalization program, also from the therapist. So yeah, that's as far as eligibility goes.
Okay. And just a comment to add on that, I learned recently that the highest risk time for suicide is the 3 to 5 days after somebody leaves a psych hospitalization. So that I think was kind of surprising. And so we're really hoping to be there as a step down support for folks transitioning out of a hospital or partial program to give them some support in the kind of transition time. Okay. How Garrett Space can help. So these are support groups. So again, like Nikki said, they're led by peers and professionals. And we really invite and encourage the young people to be active participants. So they are also providing support to one another. I think just a space for them to be there with others who understand, who get it, who have walked a similar journey can be very powerful. We provide structure and support for participants to share and process their feelings, their challenges. We invite them to bring whatever is on their mind and show up exactly how they are that day. They can learn that others have had similar experiences and hopefully feel less alone in their journey. I think that walking the mental health journey can feel really stigmatizing and isolating. And so just being in a place where other folks understand and can relate is very helpful and powerful. We want them to gain skills and strategies to manage difficult days. So every single group, we bring some ideas and strategies to share and practice together, and then invite them to report back at future groups, whether they tried them and how they worked. Really, the goal is to create hope for not only the future, but the present and the future. So that's what we hope the groups will give them.
And this is kind of similar to what Peggy was just saying on the previous slide. As far as expectations, what can the participants expect? So we're hoping to create really just a safe, open, comfortable space for participants to come and just be able to share, open up, be vulnerable, and also create within those sharing, create connections, create friendship, have positive social interactions amongst others, amongst their peers. So, and then with that also with the facilitators and Peggy, we're also hoping to maybe open that up a little more with discussions, guided discussions, sharing various small little videos, journal experts, things like that. So yeah, we're just hoping to create warm and welcoming space for everyone just to come as they are.
One of the comments that we got recently from one of the participants was they shared that it's just so good to have a place where they can be completely unfiltered, that they don't have to, pretend or put on that happy face or say I'm fine when they're not, but just really be unfiltered and say whatever they need to say and know that they will be accepted and not judged by the others. Next is the typical group look like. So we start each group with obviously a welcome and greeting people and saying hello. We always start each group with a mood and mental health check-in. So just a simple 1 to 10, how are you doing today with your mood and mental health? Then we invite them each time to share a current challenge, a struggle, something that's on their mind. It might be a worry, or just something that, is they're thinking about or struggling with. And then we ask, would you like group input? Would you like support around that? Would you like group input? Would you like to just spend some time discussing your challenge? Sometimes they just want to say it out loud, and that's perfectly fine. Other times they might, ask for specific input, like, gosh, I can't sleep or I can't get out of bed. And what have you all done when that has happened? So just really asking from other people who maybe have had similar struggles. Then we move into an activity. We typically show up with a variety of activities, not knowing exactly what the group is gonna look like or what they're gonna need. So we sometimes have some that might encourage more energetic conversation, or it might be just being present with people who are really struggling. So we always have a range of activities ready in our back pocket to pull out. Really focusing on managing mental health and teaching coping skills. As Nikki said, we sometimes use brief videos like little snippets of a TED Talk, might be discussion prompts. Sometimes we spend a few minutes journaling, drawing, writing, movement activities. I'm going to invite Nikki to talk about that a little bit more. The Tuesday groups have a support and connect focus. So the Tuesday groups are a little bit more of a support group focus. So more conversation about feelings and thoughts and worries and things like that. Also, we do activities and want them to always have a takeaway. Every week we invite the participants at the end of the night to share a goal, an intention, something that they're going to try or commit to doing, whether it's self-care or trying some other breathing exercise or whatever it is. But we always want them to have a takeaway, and we invite them to try whatever it is that we're offering, even if they think it might not work, because you don't know unless you try. And sometimes folks are surprised that something actually worked or helped them that they had not tried before. Then we close the group by, I sort of said this a second ago, setting a goal or intention for the coming week. And then we also do a check out. So how are they doing at the end of the group? That kind of same 1 to 10. So just kind of want to get a sense of where are they at the beginning and the end. We don't necessarily expect that they will bump up during the time of the group, but it's just a nice way for them to kind of reflect on how they're doing. And Nikki, do you want to comment a little bit on the mood and movement piece?
Yeah, so on the Thursday night groups, Mood and Movement, the focus and the goal here was to create basically a group that would bring just a stronger relationship, more awareness and unity between the body and the mind and our thoughts. So we focus on activities like breathing exercises, just body awareness exercises, simple movement. A lot of them are yoga inspired, since myself and the other facilitator are both yoga teachers. And yeah, so with that, we really just try and give them small pieces of information or awareness to take away, just to really highlight how their thoughts and bodies interact in that relationship.
Thank you. And sometimes the young people are nervous about trying movement activities, especially on camera. So we always invite them to turn off their camera if they feel more comfortable, or even just, do something else while we're doing some stretching or whatever it is. Okay, so that is kind of what a group looks like. Then I just wanted to add this slide for all of us who are moving through the world and coming into contact with folks that may be struggling whether it is a client in your professional life or someone in your personal life, think it's really important to not be afraid to talk about mental health or ask, how is somebody really doing? You know, when we are interacting with one another and you say, how you doing? It's like, I'm okay, I'm fine. That's typically, sometimes you can tell they're really not fine. So how are you really doing? What's today really like for you? So just being present in that way, listening with empathy, asking, how can you support your person, whether it's, again, your client, friend, family member, offering to do daily tasks, walking the dog, picking up someone's laundry, whatever it is that might be helpful. I think especially when somebody is really struggling with depression, it can be really hard to take care of the house or take care of the tasks or do the dishes or all those things. Sometimes even getting out of bed or showering is a lot to ask. So any little thing that you can do to support in a concrete way is really helpful. Most important thing you can do is show up, be present. If that's not in person, show up. It's maybe a text or a phone call, just checking in. Obviously, as needed, connect folks to a crisis line or professional support. I have added on the slide the suicide prevention lifeline and the text line. Those are both available 24/7. They will be available. I'm guessing Amber will be sending this out, so you'll have this if you don't already. And finally, how do you refer? There are a couple ways to refer. This right here is a live link, so when you get this, you should be able to just click on that. If you are a healthcare provider referring a young person, it's a pretty simple, straightforward online electronic referral form. If you are a young person or you know a young person seeking support, they would contact me either by my email or the phone number that is listed here. If you are curious about our services or you know a young person that you think might benefit, you can also feel free to reach out directly to me. I'm always happy to talk to anybody about questions or concerns. And then finally, that is our website. What questions do you have for us?
So I see a question from Cheryl in the chat asking if Garrett Space offers case management or alternative therapies. They'd also like to know if you need to sign up or register to attend the support or wellness groups.
Yes, those are both great questions. Right now, the wellness groups are what we're offering. We are, again, a brand new program. So the groups are mostly what we're doing. I also can do referral if for some reason somebody contacts us and they're not appropriate or not ready for the support. So the groups that we offer are the Tuesday and Thursday groups currently that are free and open-ended. We could try our best to connect folks to other services, but we do not provide case management. Right now, it's the wellness groups. Long-term, our vision is to do a much more comprehensive program. Second question was, do you need to sign up? Yes, you do need to sign up. And the young people, it's a pretty simple process. It's filling out some electronic forms and having a conversation with me just to make sure it's a good fit and a good time. And then they can get started. Right now, we do have some space in our groups, and our goal is to be expanding down the road. So feel free to contact us if you or someone you know is interested.
Lisa asked in the chat, can you talk more about the residential aspect? You mentioned residential, but in and out. How are residential stays funded for participants through insurance or question mark?
We do not yet have the residential program. That is the long-term vision. Right now, what we're offering is the wellness groups, which are currently virtual. We hope to be moving in person in the near future, or maybe a hybrid. So right now we don't have the residential, but when we do, we'll share that out.
And then also just really, I was gonna say just really quickly, just to clarify, when I said in and out, I meant you could also, in the vision and the hope for the residential, but also you could come to the location just for one of the activities or just for a group and then You don't have to be an actual resident.
Lisa is asking what the vision for residential is and how long you would anticipate folks staying.
That is a question I don't exactly know right now. We are in the process of launching a capital campaign, so that piece will be down the road a couple of years. I do imagine that the length of stay will vary based on need, but definitely for a period of time post-hospitalization, or if somebody is struggling and just needs some extra support.
Just a quick follow-up to that. Who do you see paying for those services? Would that be self-pay or insurance or some other funding source?
Again, to be determined. Right now, we are funded by almost all private donations and some grant support. So down the road, I imagine that when we have the residential site, that there will be some insurance reimbursement. The goal is to allow or invite services for anybody, regardless of ability to pay. That's the hope and the goal.
Thank you, Peggy. Does anyone have any additional questions for Garrett Space? All right, hearing none and seeing none. Derek, whenever you're ready, you're more than welcome to screen share.
All right. Thank you so much for the opportunity.
Oh, thank you,
Thank
Peggy.
you all.
We really appreciate it.
Yeah, thanks, Amber. Thanks, everyone, for inviting us. I'm Derek Jackson. I'm the Director of Community Engagement at the Washtenaw County Sheriff's Office. I have a team of people with me. Marv Gundy, the Outreach Coordinator, is here with us. Some of you know him. Haley Richards is our new Lead Program Coordinator. And then I have Deontay Wilson, who's with us, a young person who just started working with us. So we're here to talk about two things. We're here to talk about two very specific programs, our We Live program, which is all about violence intervention, and about our LEAD program. And so Mr. Tay is going to share his story with us briefly. And that's going to be a perfect segue into why we're doing this work. So I'm really excited to be able to share with the community some of the work that we're doing. I want to stress a couple of pieces. Number one, we've been a member of Barrier Busters for many, many years, and partly because I know people don't often think about the role of law enforcement, but as a social worker who used to work at Ozone House, who now helps to run a police agency, there are so many intersecting points with almost all the services that you all provide, right? So when I was at Ozone House, it wasn't uncommon for a young person to be brought to the shelter by a police officer, or at our adult shelter. It's not uncommon for an officer to have engaged with someone who's homeless or on the streets, or even not uncommon for an officer to be the first connection to Safe House or other services that are on this call. And our public safety and mental health millage was passed to do this work. And so the two programs we're going to talk about here today is really funded by the voters to do a different kind of policing, a different kind of work. So Tay, are you there? So I asked Tay at the last second to kind of jump on and just share a part of his story. So Tay, if you want to unmute, and I'm just going to ask you to maybe just share with this group who you are, and a little bit of what your story is, what happened to you. And then I'll ask you a couple of questions and use that to talk about our program. So go ahead, I'll turn it over to you.
Okay, I'm Deontay Wilson. And last year, around October 15th, I was shot. And it just put me at a dark place. And then I started doing this with Derek, and everything just started coming better. Like I started really living my life.
Can you just take them through the quick version? I know we don't have a ton of time, but maybe just take them through the quick version of what actually happened. You're muted. Somehow you got muted.
Oh, I'm sorry. It was just a lot of beef. I was going to a friend's house, and I had seen some guys that I had a problem with back in the day for nothing. For real. I had a problem with them for nothing. They just started making beef, and they had started shooting at me, and I instantly fell to the ground when I first was hit. But then something just took over me to the point where I was able to get up and keep running. And once the second bullet hit me, that's when I fell and I couldn't move or anything. And that's where I came to a dark place, because I didn't know if I was gonna make it or not. I didn't know what was gonna happen. I thought I was gonna turn around and he was gonna be right there standing over me. But he just kept shooting out the car. So I seen like the dirt and everything kicking up by my head. So I just put my hands up to guard.
And so Ted, I know for a lot of people, they don't understand, like, how does a young person wind up in a situation like that? I know your family and our family's history are like right down the street from one another. So I know your family for a long time, right? A good family, loving mother, loving father. So people sometimes ask, how does a young person wind up in a situation where they're being shot at?
Just a lot of held in anger, a lot of a failure, a lack of parenting to a certain extent. Like I had my mom and I had my stepdad all my life, but for a long time back as a kid, I just remember me wanting my real dad, or wondering why he ain't here, why he didn't want us or anything.
So you get shot, we wind up connecting you at the hospital. Maybe just talk to them about that piece. Like, what was that kind of turning point to get to where you are now and all the great stuff you're doing in the neighborhood?
It was just more so like, I got to the point when I met up with you guys, you know, when I was there, I didn't really want to hear anything you were saying. At the first time we met, I was just at where I was at. But then when I spoke to the young men that we was at Willow Run, wasn't it? The old Willow Run? We was at Willow Run. I talked to them and I just seen the way everybody looked at me. Like, people look up to me. Like, I have a leader spirit. So why would I care what everybody else talking about or what everybody else said about me? And I can do this. I could change this. I could change this world that we in. I could change all the hecticness, and I can, you feel me? I can stop everybody and make sure everybody get along, and we can build something deeper and way more.
So again, I know we're pressed for time. So Tay, I want to thank you for it. I know you're busy doing something right now. So if you got to jump off, feel free to jump off or hang around, because there might be questions for you. So I'll leave that up to you. But I thank you for always sharing your story, for being the leader that you are in the community. And I'll just say to this group, part of what Tay is talking about is something called We Live. And we could spend the entire session hearing Tay's story, learning about it. I think it's always important for us to hear directly from the people who are impacted by the work, but also who are doing the work. And so Tay's story is not a unique story, in that we have a long laundry list of young people who've been shot or have been victims and survivors of significant violence in our community. And now we're talking about, what do we actually do? So Tay, can you just mute for me for a second? I can hear in the barbershop, I hear the background. I'm going to share my screen and just walk you all through, and feel free, Marv is here, Tay is here to kind of help me answer some questions. So feel free to ask me questions as we go along. So one way that we decided to start dealing with violence in our community is to really have this ecosystems approach. It's not just one program or not. And some will say, well, why is the sheriff's office doing this work? I think for two reasons. Number one, we're closely tied to it. But number two, it's not being done anywhere else in our community. And so when you think about exposure to firearm violence, approximately doubling the probability that a young person will commit violence within the next 2 years, that's pretty significant. And this isn't just our data, this is data nationally. But think about that. A young person exposed to firearm violence is likely to then perpetuate violence against someone else within the next 2 years. I'm just going to ask this group a question in the chat. If you had to guess, if you think about all the shootings we've had in Washington County over the last 10 to 15 years, what percentage of those shootings would you say are retaliatory in nature? Meaning something happened to me and so I'm retaliating. So just in the chat, just throw it up there. What percentage do you think the shooting violence in our community is retaliatory in nature? I see Aaron and Emily, 80%, 70, 60, 75%. Was that Marv who said 60%? Marv, how you gonna work on the program and get it wrong? 85, 70, 80%, 40, 45, 90 from Zach. Well, the reality is roughly 80 to 85%. So when you think about 80 to 85% of the shootings in our community, not just the homicides, but shootings in general, being retaliatory, that means something happened to someone and now they're retaliating. In some words, that means it is preventable because it's predictable. We can say, if this kind of violence happens to you, you are likely to perpetuate that violence or become a victim a second time around. And so if we can predict it, that means if we can do things to actually prevent it. Hospitalization for violence-related injuries is recurrent. So with hospital readmission rates for subsequent assault as high as 44%, and with homicide rates as high as 20%. So again, that means if some violence of this nature happens to you, the homicide rate being as high as up to 20% the next time around is pretty significant. We can predict by the science that if the violence happens to you in this manner, how much more likely you are to perpetuate or be a victim a second time. That means we can prevent it. We just have to do certain things and put certain things in place to prevent that from happening. So when you look at this, what you see is just this, the nature of the injury happening. There's three things that normally happen once that injury happens. There's these symptoms of traumatic stress, which I'm sure many of you on this call are aware of what those issues may be, right? From self-medicating, maybe even getting in trouble with the law, being a part of the illicit economy, as we say, picking up a weapon, retaliating, or being re-injured. There's also this code of the street, the no snitching, or as we put in here, like I'm not a sucker to talk about what to do with the law, but I'm having this pressure to retaliate, or this lack of faith or lack of trust in policing and the criminal justice system. And so the need to kind of take care of yourself. All that leads to this disrupted sense of safety. And when you don't feel safe, you're going to do what you need to do to take care of your family. I'll give you a real life example of someone we're working with right now. He was shot coming out of a barbershop in Ypsi. His 6-year-old son seen him shot. And he says, Derek, if I have to go back to my house with my 3 kids and my wife, where they know where I live, I'm terrified of that. I feel like I don't have an option but to protect myself because no one else can do that. And there's no way I'm just going to sit there and let them kill me or my kids. That's a logical response to a traumatic situation. And so part of what We Live does is start to deal with that moment after the violence has been committed and the hospital has physically treated them, which we do a great job, right? We have some great medical institutions in our community who can physically patch people up. But what happens psychologically to someone who has been injured or assaulted in that way? Once they get discharged, they start dealing with all that acute stress and PTSD. Toss in there all the other maybe adverse childhood experiences and how that feeds into this cycle of retaliation. And so what We Live does is intervene in that what we call golden hour or that perfect window. When someone is either in the hospital and ready to really have this conversation or turn their lives around, or they're just about to get out of the hospital or they're back to the streets, but before that acute stress can get out of hand and turn into wanting to retaliate. And that's really where we met Tay. He was in the hospital. We got a call from the hospital social worker, and we just went out and reached out to him. And using community violence interventionist specialists, like people who are trained, who have this expertise. Tay is now in training to be one of these individuals. There are many things we can learn in a book. We can teach someone how to do an ACE assessment. We can teach someone the right kinds of questions or demeanor to have, but you can't teach laying on the street because someone has shot you, thinking that you're going to die, and knowing the path to success like Tay is walking. And so what We Live is doing is professionalizing that expertise, paying people to do this work and to save lives. And so part of what we really wanted to talk about today is just to let you know that in our community, we're doing this work. And we want to do it for a couple of reasons. Number one, this is dangerous work. You can imagine dealing with someone who someone tried to kill is a whole different level of crisis and trauma. You can imagine that some of the individuals involved in this work that have been shot or shot at or are doing the shooting, right? That can be dangerous stuff. But we also know failure to do that, the needle doesn't move and we're losing people. I keep this book in my bag that I carry with me everywhere of every young person that's been murdered in Washtenaw County since I started here in 13 years ago. And I'm on page 4. So I have 4 pages full of young people who've been murdered in Washtenaw County, one of the safest counties in the state, one of the most educated counties in the state, one of the communities where it's rated the best place to raise your kids, but yet we have certain kinds of things that we aren't dealing with. So part of today is just letting you know that if you have young people who are either engaged with or who are survivors of violence or who are in the middle of it or who are closely associated with it, that we do have a team of people who have been there as victims, as perpetrators, and who are survivors, who are now helping people to learn how to walk that path. One quick story I'll just give you. We had a young person who was shot in the chest, almost died. One of our officers literally used a Walmart plastic bag to cover their chest to keep him alive. And as I was talking to him, and we're in the hospital with him, he gets to meet the guys. He's like, yeah, this sounds like something I can be involved in. In all my years of being a therapist, I've never had this happen. He asked me after the fact, a couple of days later, he says, Derek, can you take me to the trauma group down in Detroit? And in that trauma group is all young guys and girls who've been shot. And I was like, of course, I'll take you to the trauma group. Now picture that. You have this kid who's been on the streets, involved in some of this gang stuff going back and forth, but he's begging, quite honestly, to go to a trauma group to help deal with him not being able to sleep at night. And when he gets there, he's surrounded by all these other young men who've been in a similar situation. And as he's sharing his story was one of accidentally being shot by a friend. He's sharing a story, and one of the other young men in the group interrupts him and says, do you ever think about retaliating against your friend? Now, again, I've been doing this work for a while. I had never thought to ask him that question. I've never been in that situation. And he immediately looks at the other kid in the group and he starts to get emotional. He says, every night. And what that really showed me was, regardless of all of our training, this young person who had been in the exact same situation, who was accidentally shot by his friend, was the only person who could really resonate and connect with this young person I was working with in a way that attached to the core issues that he was really dealing with and the trauma he was dealing with. So with that, I will pause. I have another piece that I want to transition to talk about, but I'm interested. Questions, thoughts that people have, anything like that that people want to ask.
Yvette or Tony have asked, how can we get this into 4197, 48198, the Ypsi and Ypsi Township zip codes? Can you come into the community?
So this is where we're at. So it started in 48197 and 98. So We Live is new as far as naming it, but we've been doing some of this work on the side. It's based off of a program out of Detroit, which is called D-Live. You can Google D-Live. It stands for Detroit Life is Valuable Every Day. It's a best practice program around doing hospital-based violence intervention. Ours is a little bit different because we're doing community-based violence intervention. And so we've had a couple of cases here, our most recent shootings, about 8 people now we're working with. So we're just beginning to get the word out there, which is partly why we're doing this presentation here, is to make sure the community knows about it. Now that we have staff, now that the millage is funding people to do this work, now that we have young people like Tay being hired to do the work, now we're really starting to ramp up our capability, Yvette. So it's a great question. And so hopefully we're just getting the word out more and more that we are available. Because I work at the sheriff's office and we're affiliated, like any shootings that happen, we're going to be aware of. And so that's kind of how we're going to kick into action. But if you know of young people, or if you have the need, we'd love to provide Tay with more opportunities to share his story in detail, to have our other outreach workers be able to do that, and then just to connect with young people in the community to really help in any way that we can. And Yvette, yes, I want to prevent the shootings. That's a part of what we're trying to do, because when you think about it, if we know 80 to 85% of our shootings are really retaliatory, if we can deal with people before they think to retaliate, we can really have a major impact on any future shootings. So it's a great point, Yvette.
This program is like beautiful. And I'm wondering about that intervention piece in the hospital. and the trust building that must be quite difficult. Because in my mind, I think that the retaliation piece probably comes in pretty quickly into a person's mind. So what's your approach with them when you first visit them in the hospital?
Great question, Rebecca. So, Marv, I'm not sure if you're still on or you can unmute because you're doing some of this more than I am right now. But I would just say that I think a part of it is having the right people who can do the work, right? Having the right people who are trained to do it. So it's one thing for me to walk into a room and start to establish a relationship. It's another thing for Tay or for Marv or someone who's kind of been in one of these situations to engage with them. So I'll let Marv kind of talk about exactly how they do it.
And you brought up the golden moment or the opportunity. I'm glad she highlighted it. That time when they're in the hospital, you know, there is the retaliation in their mind, but I think more or less there's a lot more fear of the unknown of what's ahead. You know, you got kids thinking they're going to die, not knowing their condition. But the great thing about it is the individual that's talking to them has been through the same situation. So the empathy that they can share, it's monumentous in their thinking patterns as far as what they want to do when they leave. Like the question marks are answered because they give them play-by-play scenarios on what can happen, what can happen. Like the situation where Derek shared, he was in the hospital with the individual from D-Live, and he shared with somebody about marijuana because he wanted to smoke because he was stressed, and that was his coping mechanisms, I guess his way of doing his therapy. And he just found out that doing that while you got shot could cause blood clots or blood thinning. So these are something that he was able to learn and didn't even smoke, but it came through the messenger that was somebody that was like him. In those times, we're very good bridge builders. And I know we don't have time to share, but majority of the things that we're offering the individual is the resources that we don't give. We just bridge build to give them the support to actually ask for it from all the agencies that are on the call. Like we've been doing at the sheriff's office, if you know our work for many years now. I've been just the type of messenger for you guys to get the word out to individuals who aren't likely to utilize the service for whatever reason. And that's kind of the same thing we do in the hospital while we're in there with the training that we get to not step out of bounds or anything. We trying to matriculate them into utilizing the services the civic way so they can get the help from housing, school, medical, food, because we feel like these are the main things that's causing them to be in that cycle anyway where they're getting shot. So sorry for being long-winded.
No. I think that's perfect, Marv. I think, Rebecca, and to your question too, I think some of it is not only who you have, but, you know, our community is small. It's small geographically, but it's also small kind of like family relationship wise. It's very rare for a shooting in our community to happen where someone on our outreach team doesn't know or have a personal relationship with someone. And so some of how we really engage is reaching out to mom of that person who's in the hospital or reaching out to uncle or cousin of someone and getting that direct introduction if we don't already know them directly. In Tay's case, it was mom. So, you know, we connected with mom because we had a relationship there. And mom basically told Tay, these people are coming to visit you. And you can hear him even said it, like when we first came in the room, he wasn't listening. Right. But I think how you slowly establish that rapport. And then the other piece, and this is where I think it's important for this group in particular on the call. As Marv said, we don't create all the resources. We're the bridge builder. At some point, we will be knocking on your door for assistance that this person might need. And I think us in Washtenaw County being able to have those resources that are relevant to individuals in Tay's situation, I think is really, really important. And when I say relevant, it's also timely relevant. So someone might need, to your point, Rebecca, some assistance right away, because that retaliation or that ability to go back to the house, if I go back today, I might get shot tomorrow. Like, and so some of it is like raising the level of the crisis, which is another reason we really wanted to share with this group. You know, I don't often comment on some of the barrier busters things, although I pay attention to them. Usually when I send something out, it's pretty significant, like we really need help for a particular individual. And I think it's the same thing with We Live. So thank you for that. Other questions or thoughts?
You know,
And hopefully,
Derek,
Rebecca, that answered you.
you know, my name is Leslie, and I was just wondering, there are several shootings, but my question is, what can we do to prevent these young people from getting a hold to firearms? I mean, I know it sounds funny, but I mean, there's got to be a way that, you know, we can prevent that, you know, even if, you know, changing the law about bullets, you know, take them off the market. There's got to be the way to stop some of it.
Yeah, and what you're talking about, Leslie, is that entire ecosystem. So it isn't just the work we're doing with, say, someone in the hospital in the prevention work. It's also what we now start calling compassionate enforcement. Like there's if you grew up in a violent community like me, or where I raised my family, like you definitely know you need some enforcement capacity. Like when someone's firing a gun and your daughter is hopping under her bed, the reality is you want someone to come in there and help keep the neighborhood safe. So it is an all of the above option. It is about finding out where the guns are coming from. But it's also the hearts and the minds of individuals. And Tay only alluded to it. You know, he talked about his father, his biological father, and the anger. I would just say to you all, that to me is a golden nugget of what we should really be focusing on when we're talking to young people, in particular, these young Black boys who are in this lifestyle, because they are telling us very loud and clear what's bothering them and what they need help with. And so we need to have the services, Leslie, to your point, that really can relate and attach to the Tays of the world when they're young before they ever think about picking up that gun. So anyway, I'll get off my soapbox, Leslie, but I agree with you 1,000%. It's an all of the above kind of attack that we have to do. And again, it's kind of changing the conversation in Washtenaw County. Community street level violence is a public health issue. It is not a police problem or a specific neighborhood problem. It's a community issue, and we need to start dealing with that public health crisis in a much different way than we have been in the past. I'll give you an example. When a young person commits suicide or overdoses, you know what the school does? They wrap around the student body, the friends, and the family. When a young person in a school is murdered, guess what the school does? They don't do the same reaction. So ask yourself, why would we do that? Is that homicide and that person who was murdered, is that trauma for the student body not as impactful as someone who overdosed or committed suicide? Of course it is. And it's that trauma not being dealt with that then breeds the anger for other kinds of retaliation that we are as a community not even tackling. So again, Leslie, thank you for that question. I think it's a perfect question. It's a larger ecosystems approach. And I hope that the members in this body can really start to think about how might your organizations start to hold up street violence in a way that's a public health way, and how might we start to shift our organizations to really highlight it, to commit to solving violence in ways we haven't thought about in Washtenaw County before. Any other last questions?
Yeah, this is Suzanne with Michigan Visiting Nurses. I have a question related to a situation I ran into recently during a home visit with an elderly individual, and there was a little bit of hoarding going on. It turns out that that individual had multiple unsecured and loaded firearms in the home. I worked with my supervisor in administration about that, but I have to admit that we were a little uncertain of how to handle the situation. So any feedback that you can offer would be greatly appreciated, because I'm sure it won't be the last time that I run into that.
That's a great question, because, you know, so there's nothing illegal about having your weapons in your home and out.
Yep.
There just isn't, right? There's nothing in the law about that. I think it's about education. It's about the other piece, though, related to it is if there are young people around the house, there can be an issue for that, right? Like it's an unsafe environment to have firearms that are loaded just around the house when you have young people. So anyone who might go into a home where you see firearms and there's young people, that's a whole different kind of conversation. But just in general, Susan, there isn't anything illegal about that. I think it's about the conversations. How I try to address it, and now I carry a weapon all the time as an officer, is that to me, one of the scariest things is not all the people who have weapons, it's all the people who don't know how to take care of and secure them. And so I really just try to talk to people about secure. A good gun owner is someone who understands the dangers of guns and can keep them safe. And so that's the tact that I try to take. It's not, you know, some people, especially if they have guns, they're not listening to you about, you know, why do you have a gun? We're beyond that. It's really about how do we talk to them about being a proper gun owner? And so that's some of the conversation I have, but there's nothing legally that can be done unless there is a threat to society or unless there are young people who may be in danger because those weapons are just out and about.
Okay, so I did counsel him to store the weapons and preferably not to have them loaded.
Yeah.
And then if he wasn't going to store them, to at least have gun locks. But I just kind of felt like maybe that wasn't enough. But it sounds, I mean, I know he legally is okay, he's in the clear. But I did just focus on being a responsible gun owner.
And we have tons of gun locks. And so, Susan, if you want some, I can get you some for free. And then if you just happen to be there, you know, oftentimes I'll just hand them to folks and they can use them. So if you just give it to him, maybe he's more likely to use it.
Okay, thank you.
You're welcome. Anything else about We Live? Again, I know it's not kind of all the ins and outs of what we're doing, but we just want to mention it so that you know what's going on in our community. You can refer people or connect with us. But also, when you hear us coming to your doors, you know what We Live is, which stands for Washtenaw Embraces Life is Valuable Every Day. And we're working with young people who are, just people in general, who are survivors of significant violence and violent assaults. All right. So with that, Amber, I'm just going to transition really quick. Me and Haley would jump into LEAD. I'll try and be brief and quick. So PART We Live. LEAD is something totally separate. And I know we got a whole bunch of acronyms. But again, LEAD is funded by the millage. It is Law Enforcement Assisted Diversion and Deflection. I know there are tons of conversations going on, rightfully so, around the country and here locally around alternative responders, non-armed police response, you know, having police not involved in certain kinds of situations. I get it, understand it, we should have that. We should have all the different rungs on the ladder because there will always be a time when, for the foreseeable future, where officers are called to a situation because this is, say, a neighbor confuses behavioral issues with criminal issues, or maybe those behavioral issues are criminal in nature. So we still will always need a tool for officers who arrive on scene to divert someone. Right now, we have individuals who have frequent contact with police. And when they have frequent contact with police, because of a mental health issue, because of an addiction issue, extreme poverty, there are really limited resources of what an officer can do. LEAD is one of those things that we can now make sure that officers on the street have something that can be done. So I'm just going to share this brief presentation and call in Haley to help me with this. I know we're presenting it, but LEAD is not just a sheriff's office program, right? It's a systems approach. And one of the most impressive things to LEAD so far for me is because it is systems, right? You have sheriff's office who's put money into this, the prosecutor, the public defender, the local prosecutors, and community mental health all have staff who are working on the LEAD program, which I think makes it something more when we're in our meetings. So it's a community-based pre-booking diversion and deflection initiative that provides an alternative to arrest, citation for individuals. So it's really about those people who have non-violent kinds of cases. And what we want to do is increase the number of individuals who are receiving community services like yours and decrease the number of times they're having criminal justice contact or winding up in the jail or the hospital. So LEAD is not a magic wand or a quick fix. We're working with some of the most difficult cases and most complex cases in our county. But it is a step. It's another rung on the ladder. It doesn't replace other things, but it's just another tool in our community's tool belt. We talk about the sequential intercept map. So we have looked at all the entry doors that happen to the criminal justice system, from community to law enforcement making an arrest, to detention, to jail and courts, to reentry and community corrections. And prior to us doing a lot of the work, a lot of these were empty. And there were a lot of holes in the system where people were just filtering into the jail for all kinds of reasons. Now we've started adding things at all of these intercepts, one being at the deputy level out on the street. I'm not going to go through this in detail, but if you think about the war on drugs and how much of a miserable failure it was, we've been incarcerating people for years because of addiction. If you look at the data, it really talks about the war on drugs was an abysmal failure. And so now, thankfully, we're smarter as a community. And so now we're treating addiction as a health issue and getting people the help that they need. We're also shifting the officer's role in that particular conversation. So why here in Washtenaw County? This is just one snapshot in one quarter. It's back in 2015, but this is not out of the ordinary. I get this report from our medical provider in the jail, and 43% of the inmates at that time were on psychotropic medication. So think about that. 43% of the incarcerated population in the jail were on psychotropic medications. That is not everyone who's diagnosed or misdiagnosed or just not on medication. So you can see where the jail becomes, in many parts of the country, the largest mental health provider, not the best, but the largest mental health provider or houser of people with mental illness. And that is definitely the case here in Washtenaw County. One of the things we did was we started asking different questions. When you look at the number of times someone had been in our jail, when someone comes to the jail 6 or more, 11 or more times, they're not a violent offender. If they were violent, you'd be in prison, right? If you're coming in and out of the criminal justice system because of violence, you'd be going to prison. So we started to ask the question, when these people are coming in this many times, what are the issues that they're dealing with? And I'll just ask you in the chat, what are some of the things that you think people might be dealing with if they're coming in and out of the criminal justice system, not going to prison, but in the jail? You want to just drop in the chat just a couple of quick thoughts of what kind of crime might they be? Any ideas? Loitering, theft, Rebecca? Yep, small amongst us, theft and stealing. Yep, absolutely. What else? That theft might be what they use to pay for their drugs. Public intoxication, absolutely. You may have a lot of people who are just have their drugs on them or who may be addicted. It could be prostitution, Rebecca. You know, when we did a study years ago now, and we talked to every person who was working the streets that we came into contact with, 98% of them were long-term addicts. And so yes, they were prostituting, but they were doing that because that's how they were making money for their addiction. And so again, prostitution may be how we engage with them, but prostitution and dealing with prostitution, the ability to address the root cause isn't simply by arresting them and putting them in jail, it's dealing with the underlying issue of addiction. So obviously you guys get it. You know, those who need to be in jail, they're going to be in jail, right? We're talking about violent offenders. Yep, there's a place for them. But now shifting, those who need help can get the help that they need. And again, why we're sharing this with you all is that some of the help they need is through you. We don't create all the services ourselves. It really is about us establishing that connection, using the system and the deputies who are the front door to many of these services to do something different. Haley, I'll just turn it over to you if you want to talk about how the cycle of it actually works and what LEAD really is.
Yeah, so right now, the current status quo of the criminal justice cycle is what it looks like on your screen there: booking, detention, prosecution, incarceration, release, and arrest. And so LEAD comes in at the pre-booking stage. It works to divert individuals from the criminal justice system in the first place. That's the goal. We'll go to the next slide. And this, I think, is pretty eye-opening as an example, statistical example of a LEAD candidate. So this was someone that one of the deputies actually referred to us to the LEAD initiative. So they were in the Washtenaw County Jail 55 times since 2005. They spent a total of over 1,400 days in the Washtenaw County Jail with a charge history of 176. In Washtenaw County alone, they had nearly 400 police contacts, and they were for things like, as you all mentioned earlier, disorderly, robbery, numerous trespassing, etc. And so you can go, sorry, you can go to the next slide.
All right, I clicked on it on accident. I just want to comment on this just so people see. So you think about someone having 381 contacts with the Washtenaw County criminal justice system. That is a lot. And we're not even talking about a full lifetime, right? So the earliest booking was in 2005, have 176 different charges, 55 times in the jail. Just imagine that for a second. That is a perfect red flag for our community that, number one, arresting in jail isn't working, isn't deterring, isn't solving the root cause. There's other issues that are there. LEAD is one way, because our deputies see this issue probably first before many others do. I know we don't think about police in this way, but those 176 charges or 381 police contacts are 381 times that police officers have engaged with this person. And officers, contrary to popular belief, want to help people. And when they see the same person over and over and over, if the only tool they have is arrest or the hospital, they're just as frustrated as anybody else. So LEAD gives them a tool to then be able to connect them to you all to deal with the underlying root causes.
And then in thinking about how LEAD actually works, so as the previous slide that showed that cycle of arrest and release, LEAD works by using an intensive case management initiative, and it's harm reduction based. And so we're connecting them to services that folks in the community like you all provide: housing, treatment, legal advocacy, peer outreach, life assistance in obtaining their identification. I know that's a goal of a couple of our initial participants, and really tailored to their individual needs, however. So addressing the highest needs first and thinking about a housing first model, but really dependent on their individual goals. And then the referral process, right now, there are two ways that someone can be referred to LEAD. We have pre-booking diversion. That's when someone in lieu of arrest or citation, as we mentioned earlier. The second one is, and currently we're starting with social contact referrals. So that's someone that a deputy is referring someone because they have a history of offenses, as you all saw the example, and they might be likely to commit an offense in the future. LEAD's completely voluntary, so if someone doesn't agree, the typical process is initiated. However, there's no repercussions for not wanting to participate if the individual is a social contact referral. And then there's a case manager that they're assigned to. We have a LEAD prosecutor, and we also have regular team meetings to talk about participant progress.
So I just want to say, Haley, I know we're running out of time.
Mm-hmm.
So maybe we can just walk through just real quick. I'll talk about the team of who's a part of it, and maybe you can just speak to the process of how they go through it. So real quick, there are 2 case managers that are out of community mental health. There is Haley, who runs LEAD. She is a sheriff's office employee. There are 2 outreach workers who are community-based peers who technically are a sheriff's office outreach team, but assigned to LEAD. There is a LEAD prosecutor in Prosecutor Ellie Savitt's office who reviews all the cases of a LEAD person who gets diverted. There's the prosecutor out of Ypsilanti Township, which is where our pilot program is beginning. And then there is a person out of the public defender's office who's also assigned to LEAD. And what happens is that an individual is referred to this operational work group. As long as that person gets an assessment within 30 days, the charge that they were going to be arrested for goes away. So the key is just to connect with LEAD case manager and do that assessment. And literally the case goes away, doesn't move any further, doesn't go to court, doesn't go to the prosecutors, doesn't show up on their criminal history. The whole goal, however, is to really help that person start dealing with whatever the major issues are that they're dealing with. We know there are other programs in our community that do and overlap and do some of this work. But again, using certain peers who've been there, who've done that, having that connection with law enforcement is something that's unique, but also having that systems approach. The day we walked into the room and the prosecutor from Ypsilanti Township said, hey, I just want to let everybody know that that person came before me and I didn't charge it. I just dismissed the case and here's what we're doing. I was like, win, right? We're doing something different to help people versus just arresting them and continue to prosecute them. Someone with like 50 trespassing notices on them, trespassing ain't working. It ain't doing anything. Not helping people who are business owners, definitely not helping that person, not helping that person's family. So like we need to try something different. So Just because I'm looking at the clock, I know we're running up on time for your entire meeting, and I promised Amanda I didn't want to take over the entire meeting. I guess we'll just kind of pause there. Again, we wanted to mention it when a lead case manager, who we're now starting to roll out, maybe calls you, or one of your current clients say, I'm just now enrolled in this lead program. This is what lead is. Happy to answer more questions, kind of offline about it. Haley, if you want to drop your contact information in the chat, she's the coordinator of lead program. But we just wanted people to know, just in case you get calls or questions around what lead is, this is what lead is and what we're trying to accomplish.
We do have one question from Rebecca in the chat, and I think it's really relevant, both for this and like our mission for Barrier Busters, asking about housing security for multiple offenders. Is it common?
Yes. And so the quick answer, Rebecca, is yes. So housing is a major issue for a lot of the people that we're dealing with. And right now we're in Ypsi Township, so we're focused on the eastern part of the county just because of the numbers that we had around mental health, housing issues, and addiction. But that housing insecurity, or even if they're not insecure, housing safety has been a major issue that we've already started to see in the very beginning stages. We just started, Dan Kelly and Haley and I just started like talking about like what's the best way to start, maybe dealing with some of that. So we're just embarking on kind of housing folks really attending those operational work groups with LEAD. So to more to come on that one, but that's a really good point.
All right, thank you so much. We really appreciate being involved in these great initiatives in our community. I'm so thankful to have heard about both of those programs.
Yes, thank you very much.
You are very welcome. Thanks for having us, Amber. Thanks, everyone.
All right, I'll very briefly go over the Barrier Busters budget update. We do still have some general funding left. As you can see, we have minimal general funding available countywide, but we do still have money in the Immigrant Assistance Fund available in Ann Arbor and Pittsfield for those residents specifically. Does anyone have any questions about Barrier Busters funding or the program in general?
Hey, Amber, this is Nancy from Ann Arbor Public Schools. Is there a place that provides more information about the Immigrant Assistance Fund in terms of how, who's eligible and any of that information? Is that on the Barrier Busters site?
If you have an Encompass login, you can view it under funding sources,
Okay.
but it really is pretty open. So low to moderate income is a pretty broad, and just one member of the household can be an immigrant to qualify. So if you have a mixed household, that's also okay.
Okay, thanks.
Did we have any other questions today? All right, hearing none and seeing none, we'll go ahead and adjourn. Thank you guys for coming today. Really appreciate it. Have a great afternoon.